What is cancer recurrence after remission? Imagine feeling hopeful because your cancer seems to have gone away. You've finished treatment and tests show no signs of disease. But what does it really mean when cancer comes back after remission? Let's find out. Cancer recurrence after remission happens when cancer cells that survived initial treatment start to grow again. Remission means that signs and symptoms of cancer have decreased or disappeared. It does not always mean the cancer is completely gone. Sometimes, tiny cancer cells hide in the body, and they can become active later. There are different ways cancer can come back. If it returns in the same place as the original tumor, we call that a local recurrence. If it shows up in nearby lymph nodes or tissues, it's a regional recurrence. When cancer spreads to other parts of the body from where it started, that's called distant recurrence or metastasis. The timing of recurrence varies a lot. Some cancers come back within a few years, while others may not return for many years, even decades. For example, breast cancer can recur 5 to 20 years after the first diagnosis, especially if the tumor was high-grade or had lymph node involvement. The chance of recurrence depends on many factors. The type of cancer, how advanced it was when diagnosed, the treatment used, and the tumor's biological features all play a role. Certain cancers like triple-negative breast cancer tend to come back more often because they lack specific receptors that targeted therapies can attack. Others, like prostate or lung cancer, also have notable recurrence rates within 5 to 10 years after treatment. Living with cancer means understanding that remission is a hopeful phase, but there's always a chance it could come back. Regular follow-up visits, blood tests, and imaging scans are important to catch any signs early. Being aware of new symptoms like pain, fatigue, or unusual lumps can help detect recurrence sooner. It's normal to feel worried about recurrence, but support from doctors, family, and friends can make a big difference. Staying positive and proactive about health can help you manage this phase better. Remember, even if cancer returns, it can often be treated again, and many people live well with ongoing care. So, in simple terms, cancer recurrence after remission is when cancer cells that survived the initial treatment start to grow again. It can happen in the same spot, nearby, or far away in the body. The risk varies based on the type of cancer and individual factors. Staying vigilant, attending follow-up appointments, and keeping a healthy lifestyle are key to managing life after remission.